It won't come as any surprise that your eyes are one of the most important parts of your face for attractiveness, ranking second on our top 10 list that you might have seen earlier. It's easier to improve this region than you might actually think though, and there are a lot of science-backed methods to improve the appearance of your eyes and the general surrounding periorbital area. And most of these don't actually require surgery. So let's take a look at 7 key characteristics of attractive looking eyes and some science-backed methods for how you can bring your own eyes closer to the scientific ideals that are mentioned in a lot of these citations. The first point is improving your scleral color. We've discussed on the channel that your iris color typically doesn't have as much of an impact on objective attractiveness, but the color of the sclera, the actual white part, does have a surprising, significant, and measurable impact on physical aesthetics. Russell et al. Analyzed the sclera of 286 Caucasian women between 20 and 70 and found that older women have darker, redder, and more yellow sclera than younger women. Next, the authors digitally manipulated the sclera of 30 women's photographs, and people rated the wider sclera versions as younger, healthier, and more attractive. So a wider sclera can help you achieve more attractive eyes, but like teeth whitening, getting a natural result is actually very important. Previous research by Provine et al. Found that unnaturally white scleras were rated as younger, but not any more attractive or healthier than typically white scleras. More recent work by Schmetto and colleagues showed that unnaturally white sclera is a major contributor to the uncanny effect. Cosmetic eye drops, which shrink the superficial blood vessels of the conjunctiva, are an easy way to reduce the redness and increase the whiteness of the sclera for a more youthful appearance, and sometimes eye drops have more than one use, where Roth et al. Revealed that Marilyn Monroe used prescription eye drops, likely for medical reasons, which also had 2 beautifying benefits: widening her sclera and dilating her pupils. This tip is mostly for women though, as a study from 2022 found that men naturally have yellower and redder scleras than women, and showed manipulating the sclera to look darker makes faces look more masculine, while making the sclera brighter makes the face look more feminine. Higher melanin levels are a major advantage when it comes to skin aging. However, Provine and colleagues notes that those with high levels of melanin are likely to benefit the most from scleral whitening due to a higher prevalence of brown scleral spots for those with deeper skin tones. It's difficult though to make the sclera look less yellow. Using makeup around the eyes to enhance facial contrast, which is an important element of attractiveness for women and tends to fade with age, is the easiest way to mimic the effects of a brighter sclera, and as proven in Joan et al.'s research, mascara, eyeliner, eyeshadow all enhance the contrast of the white sclera against the surrounding darker skin. Let's talk about eyelashes next. A 2021 study found that while men do not benefit from longer eyelashes, women with longer eyelashes are perceived as more attractive, healthier, and more feminine. Interestingly, older women benefited most from longer eyelashes, even though lash length did not actually impact judgments of age. But then what is the ideal eyelash length? Pazui and Kingstone's 2023 research showed that the optimal eyelash length for women across different ethnic backgrounds measures about 1/3 of the eye width, with slightly longer eyelashes preferred on African women's faces. In all cases, the shortest lashes were obviously the least attractive. This area of the eyes is quite easy to improve, as mascara or eyelash extensions can achieve longer eyelashes quite instantaneously. Just like brighter sclera and darker limbal rings, it's possible that longer and darker eyelashes are attractive because they exaggerate facial contrast. However, cosmetic studies suggest that longer and thicker eyelashes also impact perceived eye size. A group of Japanese scientists showed that eyeliner and mascara makes the eyes appear up to 6% larger, or 13% in area, while eyeshadow increases perceived eye size by about 5% or 10% in area. Cosmetics are proven to enhance attractiveness, so it follows that larger eyes are more attractive on women. However, preferences for eye sizes and shape vary across cultures and are actually quite subjective to trends. A team of Korean researchers found that while wider spaced eyes were consistently viewed as more attractive on women, there was a large variation in the ideal eye size and shape across cultures. Attractive Korean eyes measured larger than the Korean population average, while attractive Caucasian and African faces had slightly smaller eyes than their average counterparts. The beauty standard for these groups instead revolved around a particular eye shape, specifically a more upturned tilt of 7.13 degrees for Caucasians, 9.98 for Africans, and both of these are much higher than the population averages respectively. In an attempt to pinpoint the most attractive eye features on women, Knoll et al. Found that typically, attractive eye shapes feature correlate strongly with perceived age, including large visible height of the iris and large upward and lateral inclination of both the eye axis and the brows. Although we're born with a set eye shape, new procedures are emerging that can alter the shape of the eyes. You've probably heard of the Fox eye brow lift before, and a 2022 brow gliding technique claims to create an almond-shaped upturned eye effect without very significant surgery. To achieve a similar effect though with surgery, a team of Turkish doctors combined combined an endoscopic dynamic canthopexy procedure with an endoscopic temporal brow lift to create what they call Bella eyes for almond-shaped eyes and upturned look on younger patients. Changing the eye temporarily is also possible by using eyeliner to extend the appearance of the eyes upwards and outwards, leading to a less rounded effect by physically making the shape look longer. Eyeshadow all along the bottom and top eyelid with white eyeliner added to the inner waterline can also emphasize the roundness and largeness of the eyes. The shape of your eyes will change over time. The fat pads will enlarge and the lid aperture will get smaller because the lower lid rises while the upper lid falls. A review of the eyelid rejuvenation literature notes the importance of considering all of these parts of the eyelid to achieve optimal rejuvenation results. First, let's look at some non-surgical options for younger looking eyelids. Research presented at the 2022 Society of Cosmetic Chemists showed that a microcurrent device are quite effective at lifting the upper eyelid, with results showing a 4% improvement of around 28 days, which in this kind of literature is actually quite significant. Microcurrent devices aren't the only facial device with science-backed results on this part of the eyes. Chang et al. Found that treatment with a fractional microneedling radiofrequency tool resulted in fewer wrinkles on the lower eyelids and improved laxity, decreased lid-cheek junction, and increased canthal tilt, while also increasing horizontal width. If you're considering eyelid rejuvenation surgery, it's a good idea to familiarize yourself with the latest procedural developments to find the right technique for your eyes, as this is a very quickly changing field. There's a new emphasis in the lower eyelid blepharoplasty literature on applying a graded approach for eyelid assessments and providing a more individualized treatment. Liu and colleagues adjust their lower blepharoplasty technique depending on the patient's level of skin laxity or fat herniation and their level of tear trough deformity. Developments in treatments for the upper eyelid include Malone et al.'s blepharoplasty procedure, which creates a wider incision in the lateral area of the brows to address excess skin and lateral sagging of the brow itself. The doctors claim that this reduces the need for further browpexy or brow lifting treatment, so take that as you will. Speaking of the eyebrows, the importance of this part of the eye region is consistently underestimated. Research from 2018 placed the eyebrows in the top 3 most important traits for both men and women's facial attractiveness. Thicker eyebrows were surprisingly judged as even more attractive on women's faces compared to men's. Based on these results, avoid over-grooming your brows to retain some of that thickness. Again though, contrast is important for this area of the eye region, with Jones et al. Finding that darker eyebrows are considered more attractive on women's faces, likely because of the high contrast that these brows provide, being perceived as more youthful. This is important to keep in mind. If you lighten your hair color, your brows could look best a shade or two darker than your actual hair tone. Typically, we associate aging with gravity taking its toll, but eyebrow aging is a little more complex. A 2019 review of the literature showed that the medial eyebrow position near the front of the eye becomes approximately 0.05 inches higher, not lower, with age. Our brow position influences our perceived age and can also impact our perceived eye size. A Japanese study found that low eyebrows closer to the eyes make the eyes appear bigger, while higher eyebrows make the eyes look smaller. So for younger and larger looking eyes, again, avoid over grooming the area underneath your brows. Remember the importance of a lower frontal brow position if you're considering brow augmentation in the future. As shown by Garcia et al., an exaggerated brow lift can lead to an unnatural surprise look on the face. While the medial brow rises, the lateral brow falls, most notably with age, and some brow lifting at the ends can actually help the face look more younger and more attractive. Facial devices are also surprisingly effective at lifting the brows. Nobile et al. Showed that just one 6-minute treatment with an at-home radiofrequency device raised the brows by 1.3 centimeters on average on the treated side compared to the untreated side. At-home microcurrent devices can also help treat sagging eyebrows, where a 2022 study found a 2.4% reduction in lateral brow sagging following treatment with a microcurrent device for 28 days. So let's talk about some more signs of aging around the eyes that can be reversed. Did you know that smiling makes men and women in their 20s and 30s look 1 to 2 years older? That's according to results from a 2021 study which showed perceived age increases while smiling because of wrinkling around the eyes, the crow's feet. Thankfully, there's a lot you can do to reduce and prevent wrinkles in this area, including chemical peels, surgery, Botox, and laser resurfacing. But prevention can be as simple as wearing sunglasses. A 2023 study showed thick temple and wide frontal structure sunglasses are the most effective type to prevent squinting and block out photoaging UV rays. A good skincare routine can also have a large impact on aging in this part of the eye, where research from 2021 measured a reduction of wrinkle length of 3.38 millimeters and a decrease in wrinkle area of 2.1 millimeters squared after 4 weeks following treatment with a special peptide called DABA. Now, naturally, skincare products won't be as effective as Botox at reducing crow's feet wrinkles, but it's also important to be cautious before over-treating this area. Dr. Michael Kane notes that when this entire lateral orbicularis oculi muscle is paralyzed, it does result in unnatural facial expressions. Removing these dynamic lines entirely basically will make it look like you're fake smiling even when your smile is genuine. Dr. Kane gradually reduced the dose of Botox from 7.5 to 10 units to 3.75 to 5 units per side to combat this issue. If you get Botox in your crow's feet, keep the dosage generally low and you shouldn't have any significant problems. The last point is reducing under eye wrinkling and dark circling. Which part of the face widens the gap between your real age and your perceived age the most? Rossi et al. Showed that in addition to poor skin color uniformity and a lack of lip border definition, your under eye wrinkles and bags are actually the biggest factors, making you look much older than you really are. The skin on the lower eyelids is one of the thinnest on the entire body, so it's not surprising that it's also one of the first areas where visible aging occurs. The good news is that it's relatively easy to make the infraorbital area appear healthier, younger, or more attractive. Concealer is a good temporary solution to add light in this region and also counteract dark circles. Hyaluronic acid injections, fat transfer, blepharoplasty surgery are all treatment options for a more youthful under eye area, and there are also a ton of skincare options for under eyes that have actually been shown to work. Regarding skincare, a review of the literature found evidence-backed support for the effectiveness of retinoids, topical caffeine, hydroquinone creams, and a variety of peptide compounds on the appearance of dark circles, so there is some hope for at-home remedies. Other at-home devices like IPL, radiofrequency, or Q-switch lasers have also been shown to work and generally do help to treat the area. Now, if you want to learn more about your physical characteristics or have a professional set of doctors and dentists have a look at your eyes and the rest of the face in context, then head over to the Kooves website for an assessment report to have the team take a look and give you very structured feedback on what you can do, what your options are, and get most importantly a second opinion.